CommonWell TV 2021 right here from our Orlando studios. We're introducing you to some of our CommonWell Health Alliance members. And it's time now to meet Steve Yaskin, who is the CEO and founder of Health Gorilla. And Steve, let's start off with how the pandemic has really changed the landscape of health IT, if you could expound on that.
Well, first of all, thank you for inviting me to speak. We've done it before pandemic, and I'm really happy to be here again and being a member of Commonwealth. To address your question, throughout the pandemic, we have seen existing healthcare problems being greatly amplified. As a response to pandemic, we observed industry shifting to telemedicine, virtual care, remote patient monitoring. But pandemic also amplified the deficiencies in equity to access to care, inability to provide ongoing syndromic surveillance, inability to access complete patient histories and access, potential comorbidities in treating patients. All of that has been severely impacting care delivery models. Pandemic demonstrated that the health data interoperability needs to be expanded greatly to include much broader set of actionable, up-to-date, high-quality clinical data. And all of this needs to happen in real time, including diagnostics data, which it's a medical fact, comprises about 72% of your entire journey in health. Social determinants of health is becoming extremely prevalent and important for risk-bearing organizations and switch to the value-based care, wearable data, and other various socioeconomic data from the patients. Pandemic highlighted the increased need to match fragmented data elements to patients really truly on a national scale, as opposed to within the confines of a single healthcare organization. Pandemic further highlighted that we need all three modalities to track and contain future pandemic spreads, push, pull, and notifications of the data. All of this is defined in the upcoming TEFCA regulations. And we at Health Gorilla saw a sustained increase in the value of combining this hybrid care, virtual telemedicine care, emergence of artificial intelligence, machine learning algorithms, various care delivery algorithms, innovative algorithms with traditional, historically prevalent in-person care. The rapid expansion of this digital health industry brought new care delivery pathways, disruptive new clinical workflows, and all of this is requiring access to complete clinical history, much more so than ever before. We're looking forward to public health agencies expanding mandates for the sharing and interoperability of the data, but truly at the population health level to help track and prevent pandemic-type outbreaks in the future. And hence the importance of policy setting organizations like Commonwealth in promoting this interoperability regulations going forward.
So Steve, a report came out during the pandemic asserting that up to 50% of laboratory reports that were submitted to public health lacked any addresses or zip codes. Can you maybe speak to how Commonwealth is so well positioned to really go after that and adjust to that?
Really great question. At the very inception, Health Gorilla developed its platform to enable lab diagnostic interoperability. So the push to achieve diagnostic data exchange is in our DNA, so to speak, no pun intended. We're all too familiar with the problem of lab results being sent to public health agencies and officials without sufficient identifying information. A couple of days ago, Congress has finally approved funding being spent on the unified patient ID match across the country, but we still have petabytes and mountains of data that is remaining in silos, unidentified, untied to unmatched patient identities across healthcare organizations. And unlike providers, diagnostic vendors are not currently required to share lab data and health information exchanges directly. I mean, they distribute data through the ordering physicians by building peer-to-peer connectivities to EMRs, we call them pipes, and sometimes even fax machine, still prevalent in this industry. However, a growing number of national and regional labs are committing to this effort of truly national data interoperability ahead of the upcoming ONC regulations like the TEFCA, Trusted Exchange Framework Common Agreement. And by leveraging modern interoperability health information networks like CommonWell and Health Gorilla, labs today can share results and do share results to providers across the country cost effectively and securely, and most importantly, without the need to provide this peer-to-peer pipe connectivity to the ordering physician EMR, but instead focusing on a patient-centric diagnostics and delivering results associated with identified patient to the entire care circle, not just the ordering provider who ordered the lab, but also to every single provider and care coordinator that treats that same patient. They all need to know, and the patient themselves. Also very important to deliver that. Health Gorilla, being a Commonwealth partner, is well positioned to help solve this problem. And we at Health Gorilla has built a comprehensive master patient index, record locator services to make sure that diagnostic data can be accurately matched to the appropriate patient and then shared back through the broader Commonwealth network in a true patient-centric way. And we are focused on implementing this interoperability standards for the entire diagnostic industry and also fix this garbage in, garbage out dilemma, that's so prevalent in the diagnostic world by fixing, normalizing, validating both data at the point of collection, at the lab service center, for example, as well as in our FHIR data lake storage. By the way, the FHIR data lake storage is focused on becoming a single source of truth for high quality, actionable, clean, normalized data, including diagnostics, which is, again, I want to mention it, it's 72% of your entire history, but also including social determinants of health, socioeconomic claims, financial data. And lab need to think strategically now about ways to get test results to a large number of providers in a scalable, low-cost manner. And historically, labs were tasked with delivering the data just to the ordering provider, bypassing information for the entire care circle and the patients themselves. And we are extremely thrilled that Health Gorilla and Commonwealth are working together to make it possible for labs to get clean orders, provide diagnostic results in a timely fashion, including COVID-19 results, which is so important these days, to all providers and organizations and public agencies participating responsible for that individual's care.
It was attractive for Health Gorilla to want to be part of this membership, which you have seen now grow here exponentially. But, what was that origin story for Health Gorilla and Commonwealth?
Sounds good. Great question. Health Gorilla's core mission was always to empower patients and caregivers, regardless of where that patient had occurred, where that patient had received care in the past. And Health Gorilla relies on Commonwealth expertise in the policy making and also its broader network of healthcare API connectivity. We always had built our company and our FHIR data lake on national standards. And I think our vision perfectly aligns with Commonwealth's vision of taking interoperability, bringing it to the new era, so to speak, and really doing it on a national scale and really empowering this patient-centric data exchange to improve clinical outcomes, reduce costs, and really bring healthcare interoperability to the value-based world and bring it to this new era of price transparency, much broader equity and access to health, and empowering new and exciting workflows in care delivery models. And I think perfectly aligned on that.
Why did Health Gorilla choose to be one of the first Commonwealth Health connectors?
From the very beginning, Health Gorilla recognized the vital role that Commonwealth plays in advancing interoperability nationwide. Health Gorilla was the first Commonwealth member to join the Commonwealth Connector program back in 2019 when we had this first interview at HIMSS. Health Gorilla has always been committed to the mission and necessity of the Commonwealth, and we value our membership and our participation in various committees and just broader access to the policy and the format setting and the policy on FHIR. And including the facilitation of clinical data exchange has been vital, and this partnership with Commonwealth proved to be extremely vital to our growth.
And Steve, final question. What's your friend's name, your gorilla?
Uh,
Does he have a name or a she?
uh, no, he's a gorilla. He's our chairman of the board.
Oh, I like that.
Yeah, and he's been here ever since the start of the company.
That's great. Steve Yaskin, he is the CEO and founder of Health Gorilla, one of our CommonWell Health Alliance members. And for more on them, we invite you to log on to commonweallalliance.org. Thanks so much, Steve.
Thanks for having me.
Thanks for watching this episode of CommonWell TV. To get the latest news and updates, follow CommonWell on Twitter. We also encourage you to subscribe to our CommonWell YouTube channel and hit the bell icon to receive notifications when a new episode is posted.